Hey guys, my name is Lauren and you're on my YouTube channel, and today we're talking about something really important because I keep hearing this clinical advice thrown around and it is really bad clinical advice. So we're going to get into exactly what it is and what to do if you're being told this. If you are new here, again, my name is Lauren. I'm a private practice owner, licensed clinical social worker, and board approved supervisor. And I believe that you deserve all the tips, tools, and conversations that are going to help you make sure that you are feeling confident and competent in your work in mental health and to help you grow and thrive. And this is what I do on my channel. I bring that all to you in a one-stop shop. So if you are new here, make sure you subscribe and follow along so that you never miss anything, because I'd hate for you to miss something. As always, nothing that I say on this channel constitutes clinical supervision. Please make sure that you're talking to your supervisors because you deserve good clinical support. All right, let's get into it. I keep hearing this terrible advice thrown around, and I don't think it's coming from a clinical focus. I don't think it's coming from a place of client first, and it's just really bad clinical guidance, and we need to talk about it because I'm worried you've heard it too. And that is, I keep hearing people say that even though they've already identified to their supervisor or their employer that they don't feel like that they're a good fit for their client for one reason or another, they're being told they need to continue to see them anyways. Yeah, I said that. Have you heard that too? If you have heard this, please let me know in the comments, because I am genuinely hoping I'm not the only one who's getting all this information, because that would just be odd. And I'm worried that you're getting it too, or that your colleagues are getting it, and that this is something that we are throwing around here. And if you are a supervisor listening and you've previously told this to a supervisee or someone that works underneath of you before, this is no hate or shade, but I do think that we need to be very intentional with giving good clinical guidance, because we are in charge as supervisors in mentoring people to help them continue to move forward and grow in the profession and provide good client care. And if we're not giving good, appropriate clinical support, that impacts their ability to provide services and good clinical care for clients. And we want to make sure we're setting people up for success. So again, no hate or shade to supervisors, but if this is you, then I really want you to take notes, because this is not good clinical advice. Okay, so what do? Let's say that you have identified that you're not a good fit for a client. There's a lot of reasons why you might not be a good fit for a client, and maybe we should start there. So finances, does that align? Schedule and flexibility, does that align? Therapeutic approach, does that align? Personalities, level of care that you're able to provide, what's working and not working, client preferences, special accommodations. These are all things that we have to consider when really looking at, am I the best fit for a client? If you're getting a call for a potential client and you know from the get-go, well, they're asking for only Tuesday evenings and I don't work Tuesday evenings, then that's automatically this might not be a good fit. We need to explore further and figure out, can we address this? Because if we can't, then this isn't going to work. Same thing goes if someone calls you and they say, I really need to see, I need to see you twice a week, and I'm also looking for group therapy. And you're like, I typically provide one-on-one outpatient therapy and I don't have groups. This is an immediate, you need to refer out to the appropriate level of care, because what you can provide compared to what they need doesn't match up. So whether this happens from the get-go or if it happens after you've worked with someone for a while, the result is still the same, and that is you need to listen to this and respond appropriately. Now, let's say you're working with a client and you have uncovered that despite the fact that you thought it was going to be a good fit initially, it's really just not a good fit, because now that you've spent some time with them, you started working with them, you know them a little bit better, we're starting to see kind of personality-wise, we're seeing goals, we're seeing what works and doesn't work, we're noticing that things are just not aligned. If that's the case, we need to make sure that we are addressing that immediately, because anything that we're doing to delay that is delaying the client from getting the right support that they need to help them continue in their journey to health and healing. So we have an ethical duty to respond to this appropriately. Now, here's the problem. I'm hearing people say that they have been right there in those shoes and they've taken it to their supervisor, and their supervisor has said, I hear you and I need you to continue to work with them anyways. Or we don't have any therapists here who can take them on. You're the only one available, so you're going to continue to need to see them. If you're getting this clinical advice, this is a red flag. This is not good clinical advice at all. This is saying that your recommendation and your understanding of what's happening with the client does not matter as much as whatever reason they need you to continue to see the client, which unfortunately, what I often see is they don't want to lose the client and they don't have anyone else to put with the client. And so they're just saying you need to continue to work with them. I've also seen this play out where they feel like that you're maybe overreacting or they're not taking you seriously. And so they're saying, no, you need to continue to see them. I really caution you to not take that at face value and actually to push past that, which may feel uncomfortable, but you have to advocate for yourself and you have to advocate for your client. That is your job. And so if you're like, you know what, I don't feel like this is a good fit, then I want you to take that to your supervisor. And if your supervisor says, I think you need to continue to see them anyways, this is what you do. So let's say that you really don't feel like that you're a good fit and you've decided that there's someone else that could be a better fit. Maybe it's level of care, maybe it's specialty, maybe you have gotten all that you can get done with the client and now we're saying, okay, I think they need to maybe try specialized care, or they need to go see this provider over here, or really address this issue because we've already addressed this other core issue, whatever it might be. We need to identify who is the better fit, what would that look like, how would that better help the client, and then we need to advocate for that to be the therapeutic recommendation. So if you're taking this to your supervisor and your supervisor saying, I think you need to continue to see them anyways, or just continue to work through this, I really want you to listen. My recommendation would be to say, actually, given these specific reasons that I've already identified, these specific interventions that we've already tried, these specific responses and levels of feedback that the client has already provided, I really do not agree with that recommendation. I think that they would be better served here or wherever it might be, and have some ideas of what that referral process would look like. Do you know a provider that would fit that bill? Do you know someone who's trained in that modality? And can you go ahead and kind of research and make sure that this is a good option for them? Because if so, then I would take that and I would say, actually, this over here is going to be the better fit for the client. And my recommendation as their provider is to refer them to this practice so that they can continue to work on the goals that they've set. And then stop talking and see what they say. I'm not saying to go in there and to just defy everything that your supervisor is saying and come across as insubordinate or whatever. But the reality is that we're all human, and sometimes we're not looking at it from other people's perspective. Sometimes we have different thoughts going on in our mind, and I need to make sure that I'm advocating for the client always. And so if I, as a provider, don't think that that's what's best, I have a duty to say, hey, I actually don't think that's the best approach. We need to do this instead. And don't make it a question, make it a statement of like, this is my plan of what I'm going to do. If your supervisor doesn't like that, I really encourage you to explore not doing anything about that, because it's not your job to please your supervisor. And if you genuinely feel like that you're not a good fit for someone, then ethically continuing to see them despite the fact that you've already identified that is a no-no. It really is. What happens if they then complain and say, you wouldn't refer me to X, Y, or Z after I already indicated that? Well, that looks bad on you. Or what if they say, this hasn't been helpful and I feel like that you've taken advantage of me and you've wasted my money and now I'm upset. Well, if you've documented that you didn't feel like it was a good fit and they said they didn't feel like it was helpful and you didn't do anything about that, then that's on you. So really look at this as an opportunity to kind of step in and lean into discomfort if it's making you uncomfortable, and practice some self-confidence and say, hey, this is not going to be a good fit. These are the reasons why. This is who I think would be a better fit. And this is my plan of how I'm going to help them get there so that they can continue to work on and achieve their goals. Now, I know some of you are thinking, well, what if my supervisor doesn't like that? What if that causes issues? What if they are upset with me and they don't understand and they say, no, you need to continue to do this anyways? Well, if you're a supervisor, you're probably not going to like the next thing I say, but the reality is you're the provider. So if you don't feel like that you're a good fit, that comes back on you. not your supervisor, not the agency, you. And so you need to do what you feel is best to make sure that you're working with the clients that you're most appropriate for, that are within your scope, that you're a good fit for, that you can help. If you don't feel like that they're checking all those boxes, then there's a therapist out there that can help your client get them to where they need to be. And if your supervisor says that they don't like that or they don't agree with it, well, make a little noise. Don't conform. Again, if you're a supervisor, you're probably not going to like that. But the reality is that as mental health professionals, we need to make sure that we are doing things that are in line and aligned with our ethics, and making sure that we're serving the clients that we are meant to serve within our scope, the ones that we can make meaningful work with, and that are feeling like that they're benefiting from our services. If you're just knowingly seeing somebody, despite the fact that you've already said, I don't think that I'm a good fit for you, what message are you sending to the client? That's not helpful. They need someone to say, let me help you with exactly what you need help with. It's about them. Now, again, if your supervisor doesn't like it, the long and the short of it is tough shit. Do what you feel like you need to do for the client. And if that causes a little bit of backlash, a little bit of frustration, well, you were doing what was in the best interest of the client. Make sure you document that and then keep it moving. Of course, always make sure that if you feel like that you're not a good fit for somebody and you are trying to refer them to another provider, that you're continuing to support them in the interim. So it can be challenging to find a new provider, someone who has immediate availability, that fits all the boxes and criteria that they're looking for. And so I don't want you to abandon your clients. I want to make sure that you're having good continuity of care and that you are continuing to support people in the meantime until they get connected to the right provider. But there should be a plan in place of, hey, if I'm not the best fit, this is a plan of how we're going to get you to the treatment that you need with the provider that feels most aligned with you. And this is what I'm going to do in the interim to help you so I'm not leaving you high and dry. Because again, we have an ethical duty to our clients. We cannot just abandon them. That's wrong. And if you do this, you will find that you start to see in your caseloads that you're working with the clients that are most aligned with you, that light you up, that you feel energized and excited to work with, that you feel like you're making good work and progress with, that are more likely to be happy and receptive to the work that you're providing and the support that you're providing them. And it will feel less like you're struggling to help a client. You're feeling stuck just like the client is. You're less likely to feel burnt out because you're working with the people that you're aligned with and you're helping the clients that you serve. And we all got into this because we wanted to help people, I hope. And so if you're not helping the clients that you're meant to help, then it's not always going to feel like that you're making the progress and supporting people the way that you could. If you are aligned though with the clients that you're working with and you feel like that they are a good fit for your practice, then guess what? You're more likely to feel like that you're making meaningful change. You're less likely to be burnt out and overwhelmed. You're more likely to enjoy showing up to work, and your clients just benefit continuously from all of those things. I'm genuinely curious if you've ever heard this guidance being given before, if you've ever been told this information, and if so, what you did about it. Please leave your comments and questions down below. And as always, if you are new here, make sure you subscribe and follow along so that you never miss anything, because we cover all the tips, tools, and conversations you need to hear to make sure that you are continuing to grow and thrive as mental health professionals and feeling confident and competent in your work with your clients. Alrighty, until next time, bye.